continue. So we are now on heart failure. So last time, we started our discussion with this one. Let me just repeat it. When you say heart failure, our heart failed sa kanyang responsibility or sa kanyang function, and that is to pump blood all over the body for us to be supplied with oxygen, since our organs and our tissues need oxygen in order for them to perform or to function properly. So this is not a sudden disease, ha. We have here a condition which is a progressive one. So meaning the heart will fail sa kanyang function gradually. However, there are episodes of acute decompensation wherein the body will suddenly need a lot of, magkakaroon ng problem with the amount of oxygen sa body, and then yung heart hindi na talaga niya kaya mag-supply. So in the case of heart attack, that is actually an acute decompensation. It requires hospitalization, syempre. And then if you have reviewed the video, or if you can remember the video, di ba nakita natin doon na yung start of the heart attack is actually with the atherosclerotic plaque. If there is class A high pressure, kasi in that case, the person was playing something, di ba? So, kailangan niya ng mabilis, mataas din na pressure for the blood to flow. Now, because of that high pressure, the atherosclerotic plaque may be injured. Pwede siyang magkaroon ng injury, and that is actually class an injury to a tissue, ha. So 'di ba pag example nagkaroon tayo ng wound, and then magkakaroon ng blood flow, 'di ba, after some time magka-clot yun siya. That is the action of the platelets. So in the case of the atherosclerotic plaque being injured glass, like this one, so since may injury siya dyan, magkakaroon din ng reaction yung platelet. Okay? So, magkakaroon ng blood clot here in an attempt to impede the blood flow sa injury site. So, ang mangyayari, there will be total blockade of the flow of blood, especially for coronary arteries na nandoon sa heart mismo. Kaya nagkakaroon ng heart attack. The muscles of the heart will die due to the lack of oxygen. Kasi nga nagkakaroon na ng impediment or yung blockade sa blood flow. Okay? So again, these two, these two are the most common causes of our heart failure. So coronary artery disease, we have our arteries that supply blood to the heart muscles mismo. Hindi lang siya to all over the body, ha. Our heart also need oxygen for it to pump, for it to contract. So if there is a blockade, there will be decrease in the blood flow. Hihina yung pag-contract ng heart muscle. Okay? So kaya siya nag-fail. And then there is hypertension. If there is class uncontrolled hypertension, it may damage also the blood vessels, not just in the other parts of the body, but also in the heart. So a damaged blood vessel cannot accommodate blood and cannot supply na blood to the heart muscles also. So that means makukulangan ng oxygen yung heart muscle, and pwede siyang mamatay or hihina yung kanyang function. Okay? I'm looking for something. Please, sorry for the interruption. I'm looking for my cell phone because I'm tracking the time kaya basig malampas ko sa oras. Okay, so let's discuss the two types of heart failure. We have the systolic failure and the diastolic failure. So, di ba sa blood pressure, like 110/80, the 110, yung upper part is the systole and the lower part is the diastole. For heart failure, we still have that, the systole and the diastole. Now, how do we define them and how do we differentiate them? When you say systole, class, it is when the heart contracts to pump blood. Yun yung systole na tinatawag. So pag sinabi mong systolic pressure in the case of blood pressure, it means it's the time where the heart contracts and lalabas yung blood. Mapapump siya all over the body. So when you say systolic failure, so for heart failure, the problem here is the contraction. Mahina yung contraction ng heart class. There is a reduction in the mechanical pumping action of the blood. So mahina yung pag-contract niya, mahina yung pag-pump. And it will lead to reduction in the ejection fraction. What do you mean by ejection fraction? It's the amount of blood that is ejected or pumped by the heart during contraction. So the normal ejection fraction is 50%, meaning that's 50% of the amount of blood inside the heart. Pag-pump niya, magbubuga siya ng 50% of the total amount of blood inside. That's the normal one. However, if the patient experiences systolic failure, mahina yung contraction ng heart niya. So, hindi niya ma-achieve yung 50%. Okay? So, yung father ko, di ba, he died because of heart attack last 2018. And if I can remember it correctly, yung heart, kasi yung sakit niya talaga, heart failure. So, nag-start yun siya, parang elementary pa ako. So, ano yun siya, nagpapacheck siya ng like ejection fraction ng heart niya. So, minsan 24% na lang. I think dumaan pa yung time na umabot siya ng 9% na lang yung binubuga na dugo ng kanyang heart. That's how weak his heart was nung alive pa siya. So heart failure talaga yung sakit niya. And that was systolic failure. Meron siyang problem with the contraction ng heart niya, masyadong mahina. So yung binubuga na blood masyadong konti. So imagine the 9%. But before he died, I think nasa 20 plus yung ejection fraction ng kanyang heart. Okay? So I hope that is clear. Now, how about diastolic failure? When you say yung sa case naman ng hypertension ng blood pressure, when you say diastole, yung pressure sa baba, the 110/80, the 80 is the diastolic pressure. What is diastole? Diastole class is when the heart relax. Baliktad sila ha. Systole is when the heart contracts to pump blood. Yung diastole, it's when the heart relax. Magre-relax siya kasi papasok yung dugo. Kalimutan ko kasi nakalimutan yung pen ko sa school. So if this is your heart, diba, magko-contract siya para mag-pump ng blood all over to the body. So yung mga organs natin sa body, gagamitin yung oxygen. So pag naging deoxygenated na yung blood, syempre babalik siya sa heart para magkakaroon na naman siya ng oxygen. Okay? Now, ang mangyayari, after the systole, di ba, bubuga siya dito. We also have the diastole. After that, magre-relax yung part ng blood, ay ng heart, and then papasok yung dugo. Okay? Papasok yung dugo. So that is actually simultaneous. If yung left side of the heart contracts to pump blood, the other side will relax to accommodate blood from the body para maging oxygenated na naman siya. Okay? Again, that is simultaneous. Now, what happened during diastolic failure? There is stiffness of the heart muscle. Magsistiff yung heart muscle, so hindi siya masyadong magre-relax. Pag hindi masyadong magre-relax, class, yung ating heart muscle, it means there will be reduction in the blood na papasok. Okay? There is reduction in the filling of the blood. And that will result to the decrease in the cardiac output. So, dahil konti lang yung pumasok, syempre konti lang din yung mailalabas niya. Konti lang din yung maipapump niya all over the body. For diastolic failure, pwede kasi class na the ejection fraction is not really hindi siya affected. Pwede siyang normal, yung ejection fraction. Nakaka-contract pa rin yung heart normally. Kaya nga lang, konti lang talaga yung kanyang mabubuga na dugo kasi konti lang din yung pumasok in the case of diastolic failure. Okay? Iya, pwede. Pwede both. Grabe na dyan ang both, no? Kasi talaga, stiff na yung muscles ng heart, so konti lang yung papasok na blood, and at the same time, may problem pa talaga sa contraction. So that is a very big problem in the case of heart failure. Okay? So ano yan siya? Mini-measure yan siya. If a person is diagnosed with heart failure, mini-measure talaga yung ejection fraction to check if the problem is with the contraction of the heart, o kaya yung cardiac output, okay, or the stroke volume, the amount of blood being pumped by the heart. Ini-measure yan siya to check what is the problem. Is it because the heart is really weak in terms of muscle contraction, or is it stiff that hindi siya mag-relax adequately and hindi makaka-fill in ng tamang amount of blood. So yan yung problem class, 2 types of heart failure. Any question or clarification? You can ask now. So paano ba natin maiiwasan magkaroon ng heart failure? Number 1, syempre, if we are diagnosed with hypertension, we have to really control the blood pressure. Wag nating hayaan, class, na mataas na nga yung blood pressure, tapos parang wala lang tayo kasi di ba wala naman, may mga tao talaga na mataas ang blood pressure pero wala silang nafe-feel sa body nila. Like for them, there is nothing wrong with their body, so gano'n lang. Ganun lang yung blood pressure. I remember yung mataas na blood pressure can also damage the kidneys. And then aside from that, we have the heart. Pwedeng mag-fail yung heart kasi masisira nga yung blood vessels ng heart, and that will lead also to the loss of oxygen supply, leading to problems with contractility or stiffening of the heart muscle. Now, for the case of cholesterol, to avoid cholesterol build-up, class, that is just lifestyle change. Okay, lifestyle change with the foods that we eat, and yung sedentary lifestyle, hindi dapat ganon. Meron talaga dapat exercise to avoid deposition of this cholesterol in our coronary arteries. Ayun na yung sinabi ko kanina, paano magka-heart failure. These are the causes of the heart failure: the coronary artery disease and the hypertension. Okay, so hindi yan siya basta-basta na bigla lang nag-fail yung heart niya sa kanyang function. Meron yan siyang underlying cause. So, hypertension, ayun na-discuss ko na kanina, nasisira yung blood vessels ng heart kasi mataas yung pressure. So, makukulangan na ngayon ng blood supply sa heart, leading to decrease in the contractility. And for coronary artery disease, again, there is buildup of plaque in the blood vessel. And this plaque is made up of cholesterol. Okay? So, how do we avoid that? Kasi magbi-build up yan dito and then blocking the flow of blood. This is in the heart, ha? I'm talking about coronary arteries. Kasi the heart mismo needs oxygen for it to contract. So pag nag-build up yung cholesterol dyan, ano mangyayari? There will be blockade of the blood flow. Kukonti yung blood supply sa heart mismo, makukulangan siya ng oxygen. Pag walang oxygen yung muscle, talagang hindi yan magko-contract properly. And that means the patient is at risk of having heart failure. So I hope ano na yan siya. Naintindihan na yan. Anything else before we'll move on? The pathophysiology of heart failure. Wala na? Sige. Let's discuss the pathophysiology of heart failure. How do we know that a person class has heart failure? Now, these are the symptoms, class, of these patients. Number one, they will experience tachycardia. Mabilis ang heart rate talaga ng patient na may heart failure. Huwag kayo magtaka ha kasi ma'am, di ba may problem sila sa contractility? Bakit mabilis ang heart rate? The heart rate is different from the contractility of the heart. When you say contractility kasi, it's the force. It's the force of contraction. Gaano ba siya ka-strong mag-pump ng blood? That's contractility. But when you say heart rate, gaano kabilis yung kanyang pag-beat. Okay? Itong patients class with heart failure, talagang mag-experience yan siya ng tachycardia. If you really concentrate on the video last time, di ba, during heart attack, this one is body's defense mechanism. Pag ang body kasi na-detect niya na ay kulang ng oxygen, again, kulang ng oxygen yung body, hindi nabibigyan ng enough oxygen, ang body class magre-release ng norepi and epi. Yun talaga yung parang defense mechanism niya in response to the lack of oxygen in the body. Magre-release siya ng dalawang substances na ito. Now, remember, norepinephrine and epinephrine, if magbabind sa beta-1 receptor, ano nga mangyayari? You can still remember our review or your lesson in Pharmacology 1. Remember, beta-1 receptors are found in the heart. And if these two, norepi and epi, bind in the beta-1 receptor, what will happen? Pag ma-activate yung receptor na yan, ano ang mangyayari sa heart? Yes, there is positive chronotropy. Diba yan yung effect ng beta-1 receptor? Pag activate, there is positive. Positive ito lahat ha. Positive number 1, chronotropy. What do you mean by chronotropy? This is increased
Heart rate.
Okay, very good. Heart rate. And then there is also positive inotropy. This is class referring to the force of contraction. And the last one, there is passive dromotropy. This is referring to the conductance velocity. Pag na-release class yung epi and norepi and both of them activate the beta-1 receptor, the patient will have increased heart rate. Kaya isa dyan sa symptoms ng heart failure ay tachycardia because of this one, in response to the lack of oxygen in the body. So if you get to know a person with heart failure and check the heart rate, talagang mabilis. Okay? So, again, sinabi ko nga kanina, my father died due to heart failure. Pag chine-check yung kanyang heart rate, talagang mabilis. May problem siya sa contraction. Di ba? The ejection fraction is below 50%. Pero mabilis ang heart rate niya. Even at rest. So even nakahiga lang siya, nakaupo lang siya, yung heart rate niya umaabot ng 120. Okay? Beats per minute. 'Di ba? Our normal heart rate is just 60 to 100. So meaning niya, nagre-react kasi yung body niya because of the lack of oxygen, kasi konting dugo lang yung napapump ng heart. And then, syempre, konting oxygen lang yung maabot sa body parts, sa mga organs, sa mga tissues. So talagang nagre-react ang brain. Ang brain ang may pakana niyan, ha? And magre-release ng maraming neurotransmitters and the epinephrine. Okay, leading to increased heart rate. And actually, the presence of norepi and epi can also increase the force of contraction. Pero to some extent only for the first few seconds only, especially for heart attack lang itong makakapag-increase siya ng force of contraction. Kasi yung problem talaga is the heart muscle, kulang siya ng oxygen. So hindi pa rin siya enough yung epi and norepi to increase the force of contraction unless na walang oxygen. Okay, dromotropy is conductance velocity. Remember, our heart beats because there is electricity. Kailangan ng electricity ng heart before siya mag-beat, before siya mag-pump ng blood. So, may conductance din tayo, nagkakonduct ng electricity yung ating heart. And that is the role of our ions in the body. That is the reason why in your first year, yun yung pinakaunang subject ninyo, the Pharm Inorganic Chemistry. Kasi andoon yung study about ions. We need them para mag-contract yung ating heart muscles, para mag-beat yung ating heart. So that is the reason why if the patient experiences diarrhea and mauwi siya sa electrolyte imbalance, life-threatening yon kasi isa sa talagang maapektuhan nun yung pag-contract, pag-beat ng ating heart. Okay? So we will talk about that kasi sa dromotropy, the conductance velocity, pag may problem ka dyan, yung sakit mo will be arrhythmia talaga. So we will have a separate discussion about arrhythmia. Okay? So, that's the first symptom, tachycardia. Now, syempre, since there is no enough oxygen in the body, both in the body and in the heart, then the patient will experience decreased exercise tolerance. For the first stage of the heart failure, kapag hindi pa grabe yung heart failure class, yung sa mga heavy exercise, hindi nila ma-tolerate. But if yung ano na siya, parang yung grabe na heart failure, talagang weak na masyado yung heart, even yung paghugas ng plato, o kaya paglakad, example, sa kusina, papuntang sala, nahihirapan na sila doon kapag very weak na talaga ang heart ng patient with heart failure. Okay? Mag-SOB na talaga sila noon. Mahihirapan silang huminga. So may shortness of breath pa as symptoms of heart failure. And then most of them class experience peripheral and pulmonary edema. Ano mangyayari dyan? Bakit magkakaroon ng edema? Edema is accumulation of water. Depende kung saan siya nag-accumulate. So pag peripheral, any body part, it can be in the hands, in the feet, or pwede sa mukha. Pwede sa mukha, class, mag-edema ka dyan, dito na part, magkakaroon ng water dyan. Or in some cases, the patient may experience pulmonary edema, sa lungs naman yun. Pag-accumulate yung water. So, syempre, mahihirapan huminga yung patient yan. So, bakit ba magkakaroon ng edema ang patient na merong heart failure? Okay? That is due to the problem in the contractility sa heart. Diba? Mangyayari, kapag ang problem is systolic failure, may problem sa contractility, mangyayari, konti lang, di ba, yung ejection fraction. Hindi lahat ng loob, dugo ng nasa loob ng heart mapapump outside. So maiiwan yung iba sa heart. And since naiwan siya class, mapupush out siya, mapupush out siya doon sa lungs, sa lung tissues. So yung blood, especially the water component of the blood, mapupush out siya sa tissues ng lungs. Kaya magkaka-pulmonary edema. Now, in the case of diastolic failure, wherein there is stiffening of the heart muscle, hindi siya masyadong magre-relax. So, konti lang yung papasok na blood. Yung blood class na hindi makakapasok, magsistay sa body. And ganun pa rin yun. The water component of that blood na hindi kasi maayos yung circulation, so mapupush out din yan siya sa mga tissues, kaya nagkaka-edema. So, depende na yun kung saang part siya nag-accumulate. So, the problem talaga is si heart kasi kailangan yung circulation ng blood mo maayos. Kailangan ma-accommodate niya yan siya during diastole na papasok yung certain amount of blood during relaxation, tapos ipapump niya yan. Okay? So, dapat efficient kasi yun. Pag nagka-problem ka dyan, yung circulation mo mahina. And because slow yung circulation, yung water na nasa blood natin, mapupush out siya sa mga tissues leading to accumulation. Kaya there is edema. Now, ito talaga yung makikitang symptoms sa heart failure na we can really, how do you call that? We can really conclude that the patient has heart failure, the cardiomegaly. What do you mean by cardiomegaly? Cardio means heart. Megaly is what? Mega means, ano mangyayari? Dako ang heart. Very good. Lalaki. There is enlargement of the heart. So if nakarinig na kayo class ng person na na-enlarge ang heart, mas malaki yung heart size niya, may heart failure yun automatic. Okay? Enlargement of the heart. What is the size of the heart? Most of the time, it's the size of our fist. Pero for heart failure, lumalaki yung heart nila class. That is actually a body's defense mechanism for the deficiency. Okay? For the deficiency, lalaki. Lalaki yung organ. Pag may kulang sa body, ang una talagang gagawin ng body is palalakihin yung organ. In an attempt to try to compensate sa kulang. So since ang problem natin is kulang ng oxygen sa body, aside sa magre-release yan siya ng norepi and epi, mechanism din ng body natin na palakihin yung heart muscle. Palalakihin niya talaga yung heart muscle para thinking na magpa-pump siya ng enough blood, na mas magiging strong siya kung lalaki yung heart muscle. But that's not always the case. That's not the case for our organs. Pag lumaki yan, that's a problem. Hindi siya yung blue fingernails. Kasali siya dyan sa symptoms kasi that is because of the deficiency in the oxygen supply. Pero hindi kasi siya totally visible for all patients na blue yung fingernails nila. Pero that's one of the symptoms One of the symptoms ng heart failure. Okay? Na meron din tayong tinatawag na high output failure. Okay? This is another type of heart failure. Ang tawag natin high output failure. This is actually a rare form of heart failure. Baliktad kasi ito. Pag sinabing high output failure, in the beginning, okay kasi yung heart. Okay, again, for high output failure, in the beginning, okay sana yung heart. Okay? Okay lang yung kanyang cardiac output, nakakapag-supply siya ng oxygen sa body, tama lang yung kanyang contraction, and even yung heartbeat. Ang problem nun is yung body. Okay? Sa high output failure, the problem is the body. There is a high demand of oxygen in the body. Masyadong maraming oxygen yung kailangan ng body natin. So instead na okay sana yung heart kasi nag-function naman siya properly, but because of the high demand, hindi siya maka-keep up sa oxygen requirement. So matatawag pa rin natin yung heart failure. So in this case, we call it high output failure. So anong example ng mga conditions that will lead to high output failure? We have here the hyperthyroidism. Diba, our thyroid, our gland here located in our like sa neck part. Nagre-release kasi yan siya ng hormones. We have two types of hormones being released, the T3 and the T4. We will have a separate discussion for that. But if our thyroid is very like hyperactive, magre-release siya ng maraming hormone class, especially the T3. That is the active form of the hormone. And this hormone class, ang hormone na nire-release ng ating thyroid is responsible for metabolism, especially carbohydrates and protein metabolism. So, ang mangyayari niyan, mabilis masyadong mag-metabolize ang body mo. Okay? Again, sa case ng merong hyperthyroidism, since marami masyadong hormone that will aid in the metabolism, masyadong mabilis yung metabolism. Papayat yung person na may hyperthyroidism. Kasi kahit yung mga na-store niya na example, na-store natin na carbs no in the form of fats, mabe-breakdown yun, mamametabolize yun kasi masyadong marami ang magmetabolize kasi maraming hormone na nare-release. Now, since very active yung metabolism ng body in the case of hyperthyroidism, it needs oxygen also for these organs to function and to keep up sa metabolism process. So definitely, in the beginning, there is no problem with the heart, but since there is a problem with the thyroid, the heart cannot keep up with the demand in oxygen. So ganun yung body natin, parang economics, merong demand and supply. May demand yung body natin for oxygen, and the heart needs to supply that through pumping of the blood kasi nasa blood natin yung oxygen. Okay? So aside from the hyperthyroidism, we also have beriberi. Are you familiar with beriberi? Without anyone? Kanang sa deficient in thiamine, edema sa paa, kanang sa pregnant. Okay. Sa buntis. Most of the time, sa buntis ni siya, pero it doesn't mean nga sa buntis lang yun ni siya ha. Even us can also experience very in example, pag mas stress tayo masyado, pwede tayo mag-very class. What else? Basta ang problem talaga with very is there is a deficiency in thiamine. So that is correct. Is that si Carl. Tama yan siya, Carl. Na there is deficiency in thiamine. What is thiamine? Maglubong ang tissue fibers. That is actually edema kapag magkakaroon ng manas, tapos kapag ano mo siya, piniras niyo siya, syempre, malubong dyan na siya, pero mabalik na siya sa iyang dating form kasi may water inside. Okay, thiamine is vitamin B1. Now, si vitamin B1, just like our thyroid hormone, ano din yan siya, class? Ang tawag dyan? responsible in metabolism, especially sa carbohydrates, sa proteins, and including the fats. Okay? Now, kailangan yan siya, especially in the function of the heart also, and the muscle. Actually, we have two types of beriberi. Wet beriberi and dry beriberi. Kapag nakulangan ka ng vitamin B1 for wet beriberi, no, ito yung severe form na talagang maaapektuhan yung heart. Because it cannot supply yung kailangang vitamin, the B1, na in the function of the heart, masisira yung heart muscles. Tapos meron tayong dry beriberi that will affect the nerves. Okay? So among the two, actually mas madaling i-cure yung dry beriberi. Kung nerves yung naapektuhan, if we are giving the patient B1 supplement, vitamin B1 supplement, pwedeng maagapan yung problem sa nerves. Okay? Like mag-neuropathy, ganon. Pero once na yung heart na ang naapektuhan, medyo mahirap yun siya i-reverse. Okay? Again, medyo mahirap siyang i-reverse. So that's our problem with the B1. By the way, aside from the pregnant, yung sa pregnant women kasi, hati kasi sila ng baby with all the things inside. So, kailangan ng maraming supply ng vitamin B. Okay? So, kaya mostly nakikita natin siya sa buntis. Pero actually, yung talagang at risk of having this condition, deficiency of the vitamin B1, is yung mga mahilig uminom. Okay? Yung mga alcoholic patients natin. Anong problema doon? Kasi yung ating alcohol can actually anong tawag dyan? Inhibit or prevent the absorption of the vitamin B1 or thiamine in the body. Inhibit yan ng alcohol. So be careful also if you are alcoholic. Be careful also kasi you will be at risk of having this condition. So kung sa buntis mag-edema yung paa, kung magkakaroon ka ng deficiency in the vitamin B1 kasi alcoholic ka, kung wet beriberi ang mangyayari sa'yo, talagang masisira ang heart. So, pwede kang magkaroon ng high output failure. Anemia also is a condition that can lead to high output failure. So, be careful also if you are anemic class. Huwag niyo namang pabayaan yung anemic. Baka proud ba kayo na, anemic po. Dili na siya nga na kasi aside sa lipong-lipong na imuhang mapil, kasi nga kulang ka ng oxygen in the body, di ba? In the case of anemia, kulang ng oxygen ang body kasi may problem ka with, kung yung anemia mo is iron deficiency, kulang ka ng iron, pag kulang ka ng iron, yung ng hemoglobin, hindi siya talagang mabubuo. So remember, yung hemoglobin talaga yung part of the red blood cells that carry the oxygen. So pag hindi nabuo yung hemoglobin mo, then sino yung mag-carry ng oxygen? So for anemic patients, ayun yung problema nila. Kulang sila ng oxygen din sa body kasi walang mag-carry. So magiging high output failure siya kasi the body's demand for oxygen is very high. Okay? It's very high. Gusto niyang makompensate yung oxygen na kulang. Pero may problem ka kasi talaga sa blood. So, ang mangyayari niyan, hindi maka-keep up yung heart mo. Sige lang siya upang, pero wala talagang oxygen kasi kulang kang ng hemoglobin hanggang masira na yung heart. Okay? Not really with the hangover kasi hangover is caused by another another chemical substance. It's acetaldehyde. Pero it will help. Like after drinking alcohol, you may have the vitamin B1 supplement para hindi masira yung inyong nerves or inyong heart. Anong vitamins ang makaiwas ng hangover? Ha? Ayun sa anong vitamins ang makaiwas ng hangover? Hangover? Sa alcohol? Huwag ka uminom para hindi ka magkakaroon ng hangover. Pero I don't know. Meron ba? B1 and B2? I'm not actually, I'm not saying na every after uminom kayo ng alcohol, you also drink B1 and B2. Do not use that as an excuse to drink alcohol. Na baka magsabi kayo na meron man B1 and B2, okay lang uminom. And I'll just take the vitamins. Kasi it's not really the case. It's not a drug for hangover. It will just help your body to counteract the effect of alcohol. Kasi alcohol can, again, prevent the absorption of the body of these vitamins. Okay? Yun yung problema talaga ng alcohol. Magkakaproblema ka in the absorption of these vitamins. And pag hindi mo yan na-absorb, anong gagamitin ng body mo? So, kukulangan magkakaroon ka ng deficiency. So, hindi siya cure for hangover. It's just a supplement. Okay? Take note, it's called supplement to supply what is kulang. Kasi during the time na you drink alcohol, talagang makukulangan ka ng supply ng vitamins na ito. Okay? So, do not again use that as an excuse to drink, and drink. Wala tayong ganon. Wala tayong cure for hangover. And then we have the arteriovenous shunts. When you say arteriovenous shunts, pag narinig nyo yan, may mga parts sa body class na magdudugtong yung arteries and veins. Hindi kasi talaga yan sila dugtong. Diba, from the heart, magpapump yung heart natin ng blood, oxygenated blood, dadaan yan siya sa arteries. Tapos, kung nagamit mo na yung blood, babalik na yung blood sa heart, yung deoxygenated blood, dadaan yan siya sa veins. Pero, ang totoo, hindi yan sila magkadugtong. Silang dalawa. Ano nangyari dyan sa kanilang dalawa? Before yung blood babalik sa veins class, dadaan muna yan siya sa tinatawag na capillaries. So this part here should be the capillaries. Yung maliliit natin na blood vessels. So again, hindi talaga dugtong si arteries and veins. Pero there are people class na pinanganak silang may arteriovenous shunts na merong part sa kanilang body na magkadikit, magkadugtong yung kanilang arteries and veins. So, ang mangyayari, maghahalo class yung deoxygenated and oxygenated blood nila. And that will actually disturb the circulation of blood in the body. And that may lead to high output failure. Kasi yung iba, instead na gagamitin, yung blood na oxygenated, instead na gagamitin pa siya by the body parts, by the tissues, doon sa oxygen, nababalik kasi siya sa vein. And then remember, if mapunta na siya sa vein, babalik na yan siya sa heart for it to be oxygenated again. So mangyayari, magkakaroon ng problem in the supply of oxygen in the body, magiging high output failure yan siya. Okay, questions so far? Yung sa vitamin B's, by the way, feeling mo kasi talaga makikure yung hangover mo, no? Kasi in some case, talagang totoo naman talaga siya na mababawasan yung hangover ninyo kasi nagkaroon ka na ng bagong supply ng B1 and B2 kasi uminom ka. Okay? Uminom ka ng supplement. Pero hindi siya cure ha. Do not call it a cure for hangover. Or a treatment for hangover. Kasi we don't really have that. But, wait lang please. Okay. Next, how about in the case of heart failure, no? How does our body react? Nasabi ko na yung first kanina. Itong compensatory physiological responses. If our body experiences lack of oxygen because of our problem in the cardiac output, the first thing that the body will do is this one. Nasabi ko na ito kanina. Increased sympathetic activity by releasing a lot of norepinephrine and epinephrine. Okay? So the target receptor in the release of both epi and norepi is the beta-1 receptor. Activation of the beta-1 receptor again will lead to increased heart rate, increased force of contraction, and increased conductance velocity. However, that will just be in a few moment of the heart failure. Hindi talaga siya makapag-compensate sa kulang. Kasi even though bumilis yung tibok ng heart plus yung heart rate, pero hindi kasi magiging strong talaga ang heart because of the lack of oxygen supply. And then at the same time, there will be activation of the RAAS. So our last discussion sa chapter 17, di ba, yung sa antihypertensive agents is about the RAAS, the renin-angiotensin-aldosterone system. Okay, papataasin pag kulang yung oxygen supply in the body, there will be activation of RAAS in the kidneys. Talagang marerelease si renin, si angiotensin, and si aldosterone. So, isa pa yan siya class, ang reason bakit magkakaroon ng edema. So, aside sa mahina yung circulation and the water will be pushed out to the tissues leading to accumulation. Aside from that pa, ma-activate pa si RAAS, and then remember, the A here, the other A here is aldosterone. And ano yung ginagawa ng aldosterone in the body? There will be fluid retention, water and salt retention. So makakadagdag pa yan siya sa edema. But that is actually our body's attempt to compensate with what is lacking. And at the same time, myocardial hypertrophy. Yung cardiomegaly na tinatawag natin kanina, ito yon, myocardial hypertrophy. Most of the time, pag may kulang class sa body natin, ang ginagawa talaga is pinapalaki ang organ. Para sa tingin kasi ng body, pag malaki, stronger siya. So kung ang problem is contractility sa heart, papapalakihin niya ng body natin, thinking that it's stronger. But actually, in the first moment also na lumaki siya, actually makaka-compensate pa siya. Pero after that, kapag lumaki kasi yung heart muscle, masisira lang siya na masisira. So talagang mag-progress yung heart failure after. Okay, so ito yung mga mechanism ng ating body to compensate what is lacking. So among the three, the myocardial hypertrophy is the most important intrinsic na compensatory mechanism. Ang mangyayari, again, there will be increase in the muscle mass. Sa first, it can help with the cardiac performance kasi talaga namang, totoo naman talaga class, na pag malaki ang muscle, stronger siya. Pero, sa heart, in the case of the heart and the other organs, the more na lumaki siya, the more siyang masisira. Kasi may mga parts sa heart na pag lumaki, hindi na siya makaka-function ng maayos. So example, may mga ischemic changes na siya, no? Yung mga blood vessels dyan sa heart, hindi kasi talaga din lalaki. Yung muscle lang ang lalaki. So, yung pag-feel ng dugo sa heart, hindi talaga siya totally, syempre lumaki yung mass, yung lalagyan ng dugo sa loob, liliit yon, magnanarrow siya. So magkaka-problem yung patient sa diastolic feeling after. And then yung geometry ng heart masisira din. So mahirap yun mag-feel ng dugo kung malaki yung mass. So again, it's a body's compensatory mechanism, pero it can actually lead to the progression of the heart failure. Lalala kung talagang lumaki pa yung size ng heart. So ang tawag dyan sa paglaki ng heart muscle is remodeling. Nagre-remodel yung ating heart muscle in the case of heart failure. There will be dilation, magsa-stretch yung heart muscles, magkakaroon ng changes in its structure because of the stress na na-experience niya. Mas stress kasi yung heart kasi kulang yung blood supply, tapos kailangan niyang mag-supply talaga, no. So mas stress siya, magtatrabaho siya ng bonggang-bongga. And para makakompensate siya sa kulang, nagre-remodel yung ating heart. So pag mag-remodel yun siya, ito yung labas niya, myocardial hypertrophy. So kaya isa din yan siya kapag ka nagpapa-check up, isa din yan siya sa tinitingnan, the heart size. Especially, di ba, kapag lahat naman tayo ata nagpapa-x-ray every year, parang requirement din ata yan sa inyo sa school. If I'm not mistaken, I'm not really sure with that. Pero if you're going to look at the X-ray result, 'di ba may nakalagay diyan, heart is not enlarged. Okay? So isa 'yan siya sa mini-measure during the X-ray. Kasi pag nakita in your X-ray that your heart is enlarged, it means you are having heart failure. So matagal nang nagte-fail yung heart mo sa kanyang function, na nauwi na talaga siya in the remodeling and cardiomegaly. Okay? Now, how about the cardiac performance? We have 4 primary factors that will affect cardiac performance. Ito yon, the preload. From the word preload class, magsi-stretch yung ating heart, di ba? Not stretching, magre-relax siya para papasok yung dugo. That's preload. Okay? So, pag may problem ka dyan in the stretching and feeling and relaxation of the heart muscle, syempre mauuwi talaga yun sa heart failure. Okay? So, initial stretching ito ng ating cardiac muscles prior to contraction. And then, after load naman is yung magpapump na siya. So, nasa loob na yung dugo, dumaan na siya class sa lungs para maging oxygenated. And then afterwards, systole will happen. There will be afterload. Ipapump na yung blood sa heart. So, mostly, pag nagka-problem ka with your aorta or there is resistance of your blood vessels, magkaka-problem ka din sa iyong afterload. So, ito na yung tatawagin nating systolic failure. Okay? So yung iba na may problem sila sa aorta. Di ba dyan dadaan? That's our very large blood vessels connected to our heart. Then dyan dadaan yung blood mismo before siya pupunta sa body natin. So pag magka-problem ka sa aorta, ayun, hindi makaka-flow properly yung dugo mo. And magkakaroon ka ng problem with your afterload. Di ba, may namamatay sa aortic aneurysm. Yung flight attendant na taga Jensen last time, parang aortic aneurysm ata yun sa kanya, di ba? Tama ba? If I'm not, yeah, yun siya. Aortic aneurysm yun siya. The aorta kasi is very big. So from the heart, connected yan siya masyado siyang malaki. Aabot pa yan siya dito sa may stomach natin, yung aorta natin. That's how big it is. So just to accommodate the blood pumped by the heart. Now, if you have hypertension, kasi I think in her case, she had hypertension. So hindi na nakaya ng blood vessel. Kahit malaki na masyado ang blood vessel, hindi na nakaya yung masyadong mataas na blood pressure, kaya siya pumutok. Yeah, yung flight attendant. If I'm not mistaken, that was her case. Aortic aneurysm. Pag aneurysm kasi pag pumutok yan, that is very bloody. Kasi remember, that's the biggest arteries that we have in our body, and then pumutok siya. So that is very bloody talaga. So yun yung, when I watch the forensic expert, parang nalinisan na kasi yung body nung girl. Kasi sabi niya, when she examined the body, wala nang dugo. So supposedly, if it's aortic aneurysm, it's very bloody. Pag i-open kasi during autopsy, open talaga yung body. Talagang dugo inside. Grabe. Because of the aortic aneurysm. Okay? And contractility. This will really, determine cardiac performance. So reduction in the contractility of the heart will really result to failure. Now, in the case of heart failure, yung ating mga drugs class, most of them are actually inotropic drugs. That is for us to help the heart in its contraction. So most of the patient with heart failure still responds to inotropic agents. Nagre-respond pa yung kanilang heart sa mga inotropic drugs. Okay? And the heart rate also is a major determinant of our cardiac performance or our cardiac output. Sabi ko nga kanina, this is our first compensatory mechanism in the body. Pag merong kulang, like oxygen, kulang ng oxygen, talagang magre-react yung brain, leading to the release of norepi and epi. And the target is the beta receptors to increase the heart rate. Kasi the more siya mag-beat, syempre, it means maraming blood yun na mapapump. So, nagiging compensatory mechanism siya sa kulang. Kaya yun na, naging problem na siya. Kasi nagtatachycardia niya ang patient even at rest, na ang normal natin is 60 to 100 lang. Okay? Any question or any clarification about heart failure? That is just an introduction. Introduction pa lang yun siya. Kasi yung talagang pagtutuunan natin ng pansin is the drug or the drugs used in heart failure. Kasi pharmacist naman tayo, hindi tayo nagda-diagnose ng sakit. But it's important for us to know the symptoms and the problem with the condition. Ano ba problema? Bakit nag-heart failure siya? Pero the most important thing is kailangan alam natin yung drugs na ginagamit natin for heart failure. Factor po itong alcohol. Yeah, kasi 'di ba, if I remembered it correctly, she was already diagnosed with hypertension. So meron na siyang hypertension daan. Tapos kung napainom pa siya ng like drugs, example, shabu plus can increase the release of norepinephrine in the body. It's a stimulant. So it will stimulate release of a lot of norepinephrine. So remember, if you have a lot of norepinephrine in the body, it can further increase the blood pressure. So mataas na nga yung blood pressure niya, masyado pang tumaas because of the presence of the drug administered to her. So kaya yun siya nag-lead into aortic aneurysm. Sa taas ng blood pressure, pumutok na ang blood vessel. So, depende kasi yun kung anong blood vessel yung puputok. Like, di ba, meron tayong tinatawag na stroke, if it's like sa ulo, brain aneurysm. Pwedeng stroke, pwedeng brain aneurysm. And then yung sa kanya, it's the aortic aneurysm. And if I remembered it correctly, it's on the stomach part na ng aneurysm. Not really on the heart na part, but on the stomach na part na yung pumutok. So yes, factor yung party drugs. I don't know what drug was that. Pero yes, alcohol also is one factor. So be careful also if you are diagnosed with cardiovascular conditions. Do not do not take these drugs. Alcohol is a drug. Okay, it's actually the most widely abused recreational drug. Okay, and other party drugs. Ewan ko anong party drugs yun. Kasi most of the party drugs, the party drugs are really stimulant. Stimulant sila for party ang mood. Okay? So, ma-stimulate ang tanan. Ecstasy yun. I'm not sure if that is ecstasy. Pero be careful, class. Okay? Sige. Let's talk about the basic pharmacology of drugs used in heart failure. Let's start with the drugs. Ang pinaka ginagamit talaga for a person with heart failure is the digitalis. Okay? The digitalis talaga yon. So, it's a family of plant. Ang digitalis, it's a family of plant that gives us cardiac glycosides, most especially the digoxin. Okay? So, digitalis will give us digoxin. But we have two types of digitalis. The purple foxglove, that's digitalis purpurea. Do not be confused. Anyway, purple is purpurea. And the white foxglove is the digitalis lanata. However, for the case of digoxin, dito natin yan siya mostly kinukuha sa lanata. Kasi purpurea will give us digitoxin. Ay, so that's digitoxin. Parehas lang sila ng action. Digoxin and digitoxin have the same action. However, their difference is on their pharmacokinetic profile. Masyadong mataas yung half-life ni digitoxin. It can stay in the body for at least 3 days. Maabot siya minsan ng 3 days, magsistay siya sa body. And in pharmacy class, please take note, the longer the drug stays in our body, the more toxic it is. So, kaya siya tinatawag na digitoxin. Therefore, in medicine, we don't really use the digitoxin. We use the digoxin. Again, it has similar action with digitoxin, but it has shorter half-life. So, hindi talaga long yung pag-stay niya sa body. If I'm not mistaken, that's just 9 to 12 hours compared to the 3 days or more of the digitoxin. So again, in the market, we have the digoxin class. The brand name is Lanoxin. How do you read that? Digoxin? Digoxin? Ano yung pabasa niyo dyan? I read that as digoxin. It's digitalis. So it's digoxin. Okay? So then we have here the brand name Lanoxin, and I believe you're very familiar with this. This one is a loose tablet. No? So pharmacy. Yes, loose tabs siya. Now, take note, class, that this is a cardiac glycoside. I don't know if na-encounter nyo ito in your pharmacognosy. Kasi galing talaga siya sa plant. Okay, again, si digoxin is galing talaga sa plant. And it's a cardiac glycoside. So, glycoside is a phytochemical, a plant constituent. Pag sinabing glycoside, it's a combination of a sugar moiety. Meron siyang sugar na part. We call that the glycone. And meron siyang non-sugar na part. We call that aglycone or genin. So itong aglycone na part niya, yung non-sugar moiety, that will determine the pharmacologic activity of that plant constituent, that glycoside. So in this case, for digoxin, yung kanyang aglycone, yung kanyang non-sugar moiety is a cardenolide, and cardenolides are known to have an effect in the heart. Actually, ang effect niya is inotropic. What do you mean by inotropic? Force of contraction. So, cardenolides have positive inotropic activity in the heart. So, do not forget ha, digoxin is obtained from Digitalis lanata. However, other plants also produce digoxin. These are the other plants that are able to produce digoxin. Oleander, lily of the valley, and the milkweed. Now, the very important thing in pharmacology, mechanism of action. If you are asked what is the mechanism of action of digoxin, it's the inhibition of the sodium-potassium ATPase. Okay? And the inhibition of this one will result to the increase of calcium inside the cell. Let's simplify this one. Pag si calcium kasi nasa loob ng cell, syempre remember, the heart is a muscle. And for a muscle to contract, kailangan niya ng calcium. So yun yung way of digoxin to increase the force of contraction. Paparamihin si calcium inside the cell. And that is through the inhibition of the sodium-potassium ATPase. This is not an enzyme, ha? This is not an enzyme. I hope that is clear. Kasi pag enzyme, di ba, mag-e-end sa ACE. Pero again, sodium-potassium ATPase is not an enzyme. It's a pump. It's a transporter that transports sodium and potassium. So let's have an illustration, a video for the mechanism of action of our digoxin. Wait, open ko lang before tayo mag-end. Sige, let's watch this for us to learn. Ano ba talaga ang role ni digoxin in the body? Like we have the heart here. Ako na rin magsasalita ha. So wala itong audio. So we have here the heart muscles, the cells in the heart muscles. And there you can see sa mga cells na yan, merong transporter dyan. That's the sodium-potassium pump. Pump as in P-U-M-P ha. Ibang language kasi ito, kaya ang spelling nila ng pump is P-O-M-P. That's the sodium-potassium ATPase. Ang trabaho niyan is to exchange sodium and potassium. Okay? So, kung nakita niyo dyan, ito yung ating mnemonics na gagamitin ha. Citrina antukin. Na-mention ko na, I don't know if na-mention ko na ito sa inyo, but ang trabaho talaga ng sodium-potassium ATPase is to exchange sodium and potassium. Remember, in your Pharm-In-Org, meron tayong mnemonics na PISO, potassium in, sodium out. So si potassium, ano talaga siya class? Intracellular cation. Nasa loob talaga dapat siya ng cell. Pero si sodium out, dapat si sodium nasa labas. So in the case class na nagkabaliktad sila, si sodium nasa loob, si potassium nasa labas. Labas itong dito ha na part sa taas, nasa loob itong sa baba na part. So again, in the case na nagkabaliktad sila class, si sodium nasa loob, si potassium nasa labas, mag-e-exchange yan sila. Lalabas si sodium, pasok si potassium. And ang ratio nila, 3:2. Sa tatlong sodium na lalabas, 2 potassium ang papasok. Kaya si 3 na antukin. This is a pump-HA transporter. We call this sodium-potassium ATPase. The yellow one here sa baba is the ATP. Meaning, for you to exchange sodium and potassium in and outside the cell, you need energy. You need ATP. Kaya tinawag siyang sodium-potassium ATPase. Okay, let us continue with our video. You can ask question later. Ayan, mag-e-exchange yan sila with the help of the ATP. Yung yellow na yan sa baba, ATP yan siya. Okay? Now, how about digoxin? Here comes the digoxin. Ang mangyayari niyan for the digoxin, i-inhibit niya, please get rid of the iha. Again, this is not an English language na video, so iba yung spelling nila. Walang i si digoxin. Pag nag-take ang person or ang patient ng digoxin, i-inhibit niya ito. I-inhibit sa sodium-potassium ATPase. And once inhibited, wala nang exchange between sodium and potassium. Tapos i-relate natin siya later what happened. Sodium and potassium ang in-inhibit, pero bakit nag-stay si calcium inside the cell? Okay? So again, the exchange of the sodium and the potassium is being inhibited if there is, class, the presence of digoxin. So now, here comes another transporter. This is class the so-called sodium-calcium transporter. Okay? Mag-shift yung movement. Again, mag-shift ang movement. Kasi yung isang pump kanina na inhibit na. Si sodium and potassium ATPase na inhibit na. Now, marami pang sodium na nasa loob. Yung sodium natin, pag nasa loob sila ng cell, kailangan talaga nilang lumabas. Therefore, mag-shift yung kanyang movement. Since hindi na siya makadaan doon sa naunang pump, dito siya dadaan. Meron pa tayong isang transporter or isang pump na nasa cell membrane natin. And then, ang tawag natin again dito is sodium-calcium pump or sodium-calcium transporter. But, our ratio for this, wait lang. Excuse me. Our ratio for this is 3:1. 3:1 yung ratio natin. 3 sodium will go out. And then only 1 calcium will go in. That's our ratio for sodium-calcium transporter. So ano mangyayari? Let's continue. Ayan. So dito na siya. Lalabas si sodium, papasok si calcium. Ano mangyayari? Inside the cell, we will have more calcium. So pag pumasok yan siya, if this is the heart muscle, pumasok si calcium inside, it will help in the contraction. Okay? Magiging malakas yung mga heart muscles. It will help in the contractility of the heart pag pumasok na si calcium. So yun lang. Yun lang yung trabaho ni digoxin inside the body. Any question? So dyan ako mag-i-end. We will continue on Monday. Wala? Naintindihan ang mechanism of action ni digoxin?